I would like to just kind of go around the room real quickly so folks can introduce themselves. We don't have that many people in the group. I see about 10 names altogether. So with that, I'll turn to District Attorney Weintraub. Would you start, please?
Yes, I will. Matt Weintraub, Bucks County District Attorney. I've been, I would say, engrossed in treatment, recovery, drug and alcohol issues, gosh, now for probably 7 or 8 years.
Thank you much, Matt, and thank you for being part of this. Director Herron.
Fred Herron, I'm the director with Bensalem Township Police Department. I've been here 34 years and 15 years as the director, and we're very, I will say, outside the box and progressive in recovery and warm handoffs and partnerships. And we actually became the first co-responder model in this region, and looking forward to talking about some of the stuff and looking forward to new ways of bringing treatment to people in our community.
Thank you, Fred. Melanie, would you care to jump in there?
Sure. Hi, I'm Melanie Swanson. I'm a prevention specialist at the Council of Southeast Pennsylvania, where in August I will have actually been there for 17 years. Can you believe that?
My.
I know. And so I co-chair the Bucks County Take Back Initiative with Donna Foisey of the Commission. Yes, our proud project and very highly supported by the DA's office, which we always appreciated. And, you know, we've been doing it since what, 2010 now. So time flies. And we adapted to the contactless COVID-19 protocol for our past 2 events. So involved with that, I used to chair our Bucks County Overdose Prevention Education Collaborative, and I'm also project coordinator for Neshaminy Coalition for Youth. So we are concentrating on numerous issues to try to improve the health and welfare of youth in our community, but our 2 substances that we focus on are nicotine and cannabis, but you know, of course, we're still involved with everything. So happy to be here and always enjoy these conferences.
Thank you very much, Melanie. Valerie?
Yes, hi, I'm Valerie Milroy with Voice and Vision. We are in Bucks, Chester, and Delaware counties, and we do consumer and family satisfaction teams and peer support. And I'd like to say that we wrote a guide in the last year for families, by most of it written by families and other professionals, around substance use, the growing need to know. So it's free on our website. We'd love to get it out. It's really focused on personal stories of hope, as well as education, intervention, and prevention. I also happen to be a family member, so I'm very interested in this area and around the criminalization as well, or decriminalization, legalization. Thank you.
Any of the above.
All of the above. Thank you.
All right. Thank you very much, Monica. Ryan, I see you next on the list here.
Hey, my name is Ryan Webster. I'm a community outreach coordinator for North Star Treatment Services in Montgomery County. We're a community-based PHP IOP program. I was just joining today just to kind of, find out what's going on with some of the efforts, especially since Montgomery County recently got involved started a LETI program. So just looking to, see how we can better serve our community.
Excellent. Thank you. Appreciate it. Is it Sade?
Yes, that would be me. So,
Hi, Sade.
Hi, nice to meet you all. My name is Sade Lloyd, and I'm actually a P4 pharmacy student working with CBH for my first rotation. So I'm just here today to, take down some notes about the meeting, but also just to learn more about how law enforcement, not stakes a claim, but tries their best to help the community with these issues that we're facing now. And especially it's relevant to my rotation now, so I really want to learn more about it.
Great. Thank you very much, Sade, for joining us. I see a couple of more folks jumped in here. Jamal, just care to say hello?
Yeah, I'm here. I'm Jamal. I am part of the Project Rebound Diversion Program for Norristown Police a collaboration between the Norristown Police Department and Gardenzia. I'm the boots on the ground person.
And that's what we need to hear more from, are people who are actually out in the field doing God's work, as I call it, in the communities that are, severely impacted. So thank you for being part
You're
of that.
welcome. This is the director of the program right behind me, Mr. Harold.
Thanks for joining us, Mr. Harold.
Thank you.
I think I got everybody along the way here. So we'll begin just kicking this around. There were a number of things brought up in the morning panel session that may have been attractive, may have been controversial, and we really want to give this a good go around to gauge everybody's opinions, and also to hear what your thoughts are regarding the law enforcement community's engagement in the harm reduction process, where we can operate best, how we can partner with agencies and organizations that are engaged in the efforts to mitigate overdose deaths and overdose instances, and get people that are in need of treatment to the treatment programs most effectively and at the earliest opportunity, so as to make sure that we're providing for their individual safety and the safety of the communities around them. So with that, if I can pull this off, I'm going to play a very short 1 minute snippet from a movie entitled Oscar One. It was a documentary done by Temple University's Center for Security and Criminal Justice, or Crime Research, I'm sorry, Professor Jerry, oh goodness gracious, his last name just went out of my head, but this will give a very short taste of what's a 1 hour long documentary movie about some law enforcement intervention efforts that are underway in Kensington with the Transit Police Department, not somebody you would normally think of as being ones on the front lines of this. So let me see if I can share the screen again.
We don't spend nearly enough time as we should listening to line officers, right? In terms of the demands placed on them, the pressures, the lack of tools, the lack of resources, what they need to do their job better, what they see are the most pressing issues in the communities that they serve. We need their voice in the conversation, and we haven't been, we collectively haven't done this very well.
The police, the frontline workers, can be a part of that rehabilitation and that treatment, the connection of social services, and that's what we're envisioning now here at SEPTA with the SAVE unit, using officers who have an interest in this type of work to connect the vulnerable population with what they need.
Okay. That was a very short outtake from the hour-long documentary, but hopefully, even without the sound and just the closed captions, you were able to get a feel for what was going on there. SEPTA Police, along with Temple University, initiated this SAVE project just over a year ago and put it into the what I refer to as the belly of the beast in terms of substance use disorder issues and harms in the Kensington corridor underneath the Frankfurt L. The specially trained officers were put out there with the goal of engaging people with chronic substance use disorder problems, unsheltered homeless persons, persons with problems unrelated to substance use disorder, but just general poverty and such, and trying to get them into some sort of social service treatment and support that could bring them away from the streets and away from the transit system where they've been for some time, living on the streets and riding the L's and panhandling and such, the quality of life problems that tend to burden police departments with calls for service. It's part, as I said, of an hour-long movie. I will put the link to that in the chat box at some point. But just, we've got a couple of folks on here who are already engaging in processes and programs that are doing the outreach like this. So I want to call on everybody to listen up. One of the lessons learned, I guess, during that project in Kensington Corridor was, as Dr. Jen Wood put it, we need to listen to the people that are on the street that are doing the work. And I think that's really important for us to do. So with that, what do you think? Do you think there has been enough attention paid by law enforcement to connecting people to social services? Do you think that some of the promising programs that we've seen in this morning's session and just overall in our experiences can change the curve a little bit, can bend things in a better direction? And I'll throw it out there. Fred, you lead one, you lead a couple actually in Bensalem Township. So why don't you start off?
Sure. So some years back in Bensalem, we took an offshoot of the Parry program, and we started BPAIR, which stood for Bensalem Police Assisting in Recovery. And there are 39 police departments now in Bucks County, and 19 of them now are on board. And we're lucky that B in Bensalem can be swapped out for the B in Bucks. So now it's Bucks County Police Assisting in Recovery. So it's like having monogram towels that you don't have to change. So that really worked out well for us, that we didn't have to change the B. And I think Mallory's on this, and she's pushing hard to make sure that we get all 39 departments, and we're getting there. We just had a meeting the other day, but what it is it's twofold. Is officers that are out on the street engaged in different calls, not necessarily drug calls or calls involving narcotics, but it could be family disturbances, children issues. It could be arresting someone for retail theft or other minor crimes. And then we give them the information on how to get help. And I'll talk about that in a second, on how to engage the program. This is not in lieu of arrest, so you still have to kind of pay the piper, so to speak. And the second way is our building is open 24/7, and people can come in here at 3 o'clock in the morning on a Wednesday and say, this is my moment, I want help. And we will guarantee them get them into an assessment center immediately. And then the professionals will decide on what kind of treatment they need, if they need treatment at that moment in time. And this has all been going on here in Mount Bensalem for years, probably since about 2017, I believe, if not even a little earlier than that. And it's been very successful. And all the police officers were trained in this. They were trained in the stigma of addiction, opioid use disorder, and they're the ambassadors. The men and women of the police department are the only profession in the world that are out there 24/7. Doesn't matter if it's a holiday, doesn't matter the weather. You call us, 3 little numbers and 911, and you get a response normally within 3 minutes with no questions asked, no need to figure out. We don't need to swipe your credit card for payment before you get our services. We are the only profession in the world that does that, the only. And they are out there all the time giving this message out there. We have community volunteers that go with the person if they need treatment, to somebody to sit with them and help them. We have 2 paid staff that are paid for under grants, one in the upper end of the county, one in the lower end of the county. And we've also partnered with Uber to provide rides. A foundation has picked up the cost working with Uber. So again, this is no tax money being used on this, and it's been very successful. So that is really, I can talk about BFAIR for about an hour and a half, but I won't go into the nitty gritty of it. But it's been a very successful program, and the community likes it. We reach out to people that have had overdoses when we do follow up the next day and try to get them help. We have our Be Crew program, which is Ben Salem Community Resource Unit. So that is a CRS paired up with a paramedic that respond to overdoses and do follow-ups the next day. They only work, I believe, an 8 hours, an 8 or 10-hour shift, I forget. But they obviously they're not out there all the time, but then they come in the next day and they do follow-ups and try to get people in treatment. We can't take an ambulance off the street to be able to do these follow-ups because 911 calls continue to come in. It's the same reason why we can't take police off the street. But we have the B Crew program that will allow this SUV type vehicle to respond to overdoses and to do follow-ups. And then, of course, just real quick to touch on, as I know we have other people here, we just initiated a co-responder program here in Ben Salem, where we have 2 social workers embedded in the police department. Their office is here in the police department. They have police radios and they respond with police or right behind police or sometimes in lieu of police, depending on the call, to deal with people that are suffering not only from mental health, which is the bulk of our issue with co-responders, that's what their main function is, but they're also working with B-Pair, B-Crew, and also dealing with elderly issues, juvenile issues, homelessness issues, all the social issues that we're faced with. Being a municipality, a large municipality that borders the city of Philadelphia, I mean, we're right on top of the city on multiple sides, and those are some of our challenges. And I will tell you just a quick statistic real quick. The co-responders in the first 4 months of 2021 versus the first 4 months of 2020, one particular individual, this is one, and I think my last numbers were about 2 weeks ago, they were up to 120 clients since they've been here, and they got hired November of 20. No, yes, November of 20.
Yes.
November of 20. So they're just a little over 6 months. So in the first 4 months of 20, we didn't have them. And one particular person called the police department 26 times. In the same time frame in 2021, this person called the police department 5 times. So we're down 500% call volume on one case, and that's just incredible. So it's another great program, and we try to do some new stuff here in Ben Salem, thinking outside the box, doing new things. But one of the keys, and I heard this, I think, in one of the sessions this morning, Jerry, and maybe you said, Jerry, and the man is on this. This Zoom, is a lot of this stuff. If you don't have, and for me, I'm grateful to have the cooperation and the partnership of our district attorney, Matthew Weintraub, because I can't imagine. And again, I know some people from Montgomery County, but we come up with an idea. What do you think, Matt? And he's like, sounds good to me. Let's do it. And when you have that blessing from the head guy or the head gal, things move a lot better. Just you're dealing with half the issues are gone because you got the top dog, putting his or her blessing on it. So with that, I yield my time back.
Thank you, Congressman. We're glad to have you, and those insights are really important and appreciate it. Check the chat box. There's a gentleman from Montgomery County who would love to
I'm going to respond right now.
Yeah. And to your point, the district attorney in Pennsylvania and most states, they might have different names. The district attorney is the chief law enforcement officer in a county, just as the attorney general is for the Commonwealth of the state. So without the support of the district attorney, a lot of these programs will be certainly, if not unable to launch, they will not get traction nearly as quickly. And Matt, can you speak a little bit about what your office has done to, I guess you would say, cultivate programs like Fred's programs in Ben Salem Township and elsewhere in the county?
Yes, thank you, Jerry. I'd be happy to. Fred actually didn't give himself full credit. There's another aspect of that B-Pair program where they can do the over the video monitor. They can do the assessments video. You don't even have to have transport anymore. And I thought that was very progressive, very thoughtful, reach the people where they are and eliminate that one barrier. Because as you know, in Bucks County, transportation and beds are 2 critical issues that we always face problems with. But as far as the philosophy, typically government is bureaucratic and the answer is always no. But I try to take an open-minded approach, as Fred said. I believe in cross-pollinating and partnerships. You know, I've worked with Melanie, I've worked with Mallory, Jerry, Fred, many people on this call. And there are I had to be convinced myself. I was a skeptic, but just to give you an example, and I think this is now universal all over the place. But when Narcan was first introduced as something that a cop should carry, that was novel. Even though Narcan has been around for decades, that was a novel thing. And Mallory's boss, Diane Rosati, and we took our traveling road show on the road, and we shamed some police departments. We convinced some other police departments, and we just provided information to get additional police departments to say why you should carry Narcan. And once you develop the culture and the momentum, nobody wants to be first except Fred. Ben Salem wants to be first, sure. But once you develop that culture, it becomes a lot easier. Once it's a culture of an ounce of prevention is a pound of cure, that philosophically, every department just starts to gravitate towards that. I would note that our BPAIR, the Bucks Police Assisting in Recovery, is the equivalent of LETI, from what I understand, in many areas. The other thing that we do culturally better than anyone in the state, Melanie, as Melanie knows, is our medication drop-off program. And you talk about innovations, Jerry. We now have the ability where somebody, if they're homebound, let's say, they can make a call and we'll go pick their medication up. We just recently started taking vapes. We had to ask for permission from the DEA. They said, yeah, so we take vapes. This last medication drop-off day that we had, we just started taking sharps. And so we said, this is just such a wonderful program that everybody has a buy-in. Why limit it to 2 days? So we have these drop boxes in almost every police department and in, I think, 5 out of the 6 hospitals. Don't get me started on why it's not in every hospital. It should be. So the last thing I want to speak to, and I actually got to run, I have another appointment, is you talk about trying to meet people where they are and at the earliest level to try to get them treatment. And that is our district court drug program, which now is almost immediately after arrest or summons at the very first opportunity, which is the district court. If somebody's been arrested for marijuana or a harder drug or paraphernalia for either, they qualify for this program regardless of their prior record. And the whole goal is to get them assessed and treatment as quickly as possible. And if they're a Bucks County resident, funding is never a barrier. Lack of funding is never a barrier. And even if you have a lengthy prior record, you're not going to be barred from entering this program if you're interested in treatment. You will have to plead guilty. You'll be placed on probation for 6 months if you have a prior record and it's not marijuana. If it's a marijuana offense, it could be your first one or your 15th one. You get in this program. If you complete it, you get no record. And certainly if it's your first one, that's a no-brainer. So these are just some of the ideas culturally, Jerry, that we try to foster. And frankly, thanks to Bucks County Drug and Alcohol Commission and the Council of Southeast, they're great promoters of these partnerships and these programs. And I think there's a real symbiotic relationship. You know, Mallory about, they want me to do a little TV clip or something. I'm always happy to help them out. But I think that it's important to get that word out there so that people are no longer viewing law enforcement as the enemy. They're not afraid to come to us as somebody that can help them as opposed to looking to lock them up. And we've seen a real cultural shift in Bucks County as a result of these partnerships. I'm very proud to be partners with law enforcement here in Bucks County because of their progressive and thoughtful views. If you can't keep somebody alive, you can't get them treatment. So that's the goal, and getting them treatment, getting them back into their life, taking care of their criminal issues. And then my 5th goal is I never want to see them again. Mission accomplished. With that, I got to go. Very grateful for spending a couple minutes. Thank you, Jerry. Thank you, Mallory. Have a great rest of the day.
Always a pleasure to see you, District Attorney. Hope to see you again soon. lot to unpack between Director Harron and District Attorney Weintraub and their remarks, and a lot of other ground to cover as well. And I don't want to overlook the input that we can get from so many of you folks. Jamal, in Norristown is correct. Is that where you're working? What kind of a relationship have you developed with the police department there? I know it's a borough police department in the city itself, and then of course there's the township, Norristown Township around you. Are you interacting with either or both of them? And what kind of things are you doing there in partnership with them?
Well, thanks for asking. I'm Jamal. One of the things that the program I'm a part of it was based in the diversion program. We've been operating for about physically about 10 months on the ground with the Norristown Police Department. The Sheriff Department is on board, although they're not a direct connection of the program itself. And one of the things we do, we've been outreaching from the gate, like together with myself or one of the lieutenants or one of the officers that, you know, are part of this or wants to be a part of it. And we go directly to the locations of use where a lot of the folks who are struggling with substance abuse tend to hang out at, use that, interact at, and together with the officers. In the beginning, which is a natural reaction for those who are challenged with those things, they were very apprehensive. Right, me personally, I'm one with lived experiences. That's who I am. I'm a CPS, and connecting with my peers to understand that at this current time, the police department is out here solely for the purpose of extending help, being a part of getting you the help, if need be, transporting you to the locations where the help can be received. And I will say this, as the consistency created a good relationship between the person challenged with the substance abuse and the law enforcement agencies. Me personally, I don't have that issue of relations because I am them and they are me. I'm just a representation that no matter what condition they in now, they don't have to stay there, you know, and so together, we our program is avoidance of the policing part of the situation, because we come across folks who may have things or currently are using at the moment we come across, and getting them to understand that the police are here to actually offer them help and not arrest them like we don't do during our outreaches. There's no background searches or no police work is being done at the time that we are actually out on the ground, and getting these folks to understand that whatever they may be running from, whatever they may have to address at some point in time in their life is not the purpose of why we're here right here and now. We're just here to get them help because Norristown police understand that at one time, Norristown, I guess, had the most ODs within the county. Norristown had a high ranking, and in that aspect, they realized that arresting them wasn't solving the situation, because they arrest a few and a few more come. So they got together and understood that if we can get connected with someone who is actually boots on the ground. My particular company, Gardenzia, is boots on the ground. We're active right here. Access services is wonderful, but at times when you call them, you have to wait for someone to get there. Now, and I get all overdose calls, all referrals come directly to either me or my coworker, my organization, and we can access or get to the situation within minutes. Because we've come to learn that when it comes to substance abuse users, the desire for help happens in moments. You know, next day appointments rarely happen. You know, so we were actually there, and now they're comfortable with showing up at the police department or even stopping a police car and say, you know, I need some help. And then we would get a call and we would go out there and try to offer the people some help. And it's been successful. We've had a good number of folks at least take the first attempt at getting their lives better by going into treatment, right? The relapse and stuff, all that's a known fact, but it's just the willingness has increased and the comfortability of the people have become greater when they see the presence of the police officers. Like when they with us, the police have the same shirt I have on. They say police on the back, but they're not full garment. They're not full garmented, you know, with that appearance, which for me personally was a learning experience coming from, you know, active addiction and actually now working beside, you know, a police officer. That was a great learning experience because I got to see both sides and I understand how it's hard for an officer not to implement police tactics when addressing a situation when they come accustomed to addressing it that way, you know. So seeing that transition was for me was encouraging. I live in Philadelphia, which is where y'all talk about a lot. So I actually apply that in my home area also, you know, on my personal time, you know, to try to get the folks to understand that there are a lot of officers who actually want to see you get help as to opposed to incarcerating you. So it's been a wonderful experience. And for me, I love it. You know, I don't have an issue with it. I love it. I'm out there every day.
I commend you on a lot of levels for the work that you're doing there, Jamal. I mean, number one, you know, your own lived experience and journey in recovery, I think is just, you know, heartwarming to a lot of folks, you know, that have been involved in it. Number two, your open-mindedness and your receptiveness to working with police agencies, you know, in addressing some of the problems that you encounter through your work at Gaudensia and that street outreach, you know, kind of building a pathway to recovery, I guess is the best way of putting it, you know, for folks that might otherwise end up, you know, in the Montgomery County Jail or in, you know, some, you know, negative situation otherwise. So, you know, thank you for that work. And then, you know, we can't say enough about it. There are a couple of things that are developing. I mean, they're still early stage in Montgomery, and I know I believe both Ryan and Barbara are Montgomery County folks. With the LETI-led initiative that's just, you know, kicked off in the last, I think, 45 days or so. I'd invite Ryan or Barbara, if you want to jump in here, just a very quick overview from me on what LETI is. It itself is not a service delivery program. LETI works with the county district attorneys to establish policies and provide training resources to the district attorney's office and the municipal law enforcement agencies rather than actually directing things themselves. In a county like Montgomery County, there's probably 50 or so police agencies. So it's bringing all of those folks into the fold. I'm wondering if Ryan or Barbara, you might have any experience thus far with the LETI efforts or any other observations about how this law enforcement treatment initiative effort is unfolding.
Well, we don't have much experience at all. That's, you know, to be completely honest, part of the reason why I chose this, you know, breakout room. And we're a newer outpatient facility.
Okay.
So, you know, part of, you know, my job is to figure out how we can get involved and how we can be resources, you know, to be completely transparent. You know, the company I work for, it accepts private insurance. And I know that's not, you know, a lot of what people are seeing on the streets. But, you know, something that we pride ourselves on, you know, the name of our company is North Star Treatment Services. So we're going to help connect people wherever they need be, even if they're not coming to us. If someone with Medicaid is looking for resources in Montgomery, Philly, Bucks, Delaware County, you know, that's where I step in and help connect people. But as far as my experience with, you know, I don't have much working with LETI, you know, literally, you know, I was actually happy to see Fred on here, because I'm pretty sure he's my neighbor. I live in Bucks, and I've seen him around. So I'm going to contact him to kind of figure out how he suggests I maybe navigate the Montgomery County LETI program.
Okay, thank you. Appreciate it, Ryan. And to be fair, no one has a lot of experience with LETI in Montgomery County yet, because as I said, it really
Right.
only launched, a matter of a couple of weeks back. So getting connected may be the very first step. I know Gaudenzia does have that relationship in place already, but I'm sure that there's room for more. Barbara, would you care to add anything?
Just that I apologize. You're going to hear my kids in the background destroying a
We
room.
love kids. We love kids.
You guys are welcome to babysit at any time. So we don't have much experience with it yet. My program specifically, I just got hired in April, and we're designed. My official title is the Mobile Integrated Health Coordinator. So we're kind of trying to fill in the gaps that all of these other programs might, whether deliberately or not, or whether or not they're targeted or not, we kind of are trying to catch all of that. And after an individual has an OD experience, trying to get them into a program, a rehabilitation program, and speaking with, I think, Jamal and Mr. Heron, I think would be really, really beneficial for at least me, and I know for my paramedic as well.
Outstanding. Now, to be clear, you work for the county, yes? In which department?
Department of Public Safety.
Public Safety, okay.
Yes.
So because you described mobile health integration.
It is a little different.
Mobile integrated health. So it's kind of not where you would expect public safety employees to be, since there is a health department there. But go ahead, tell us a little more about how that's proposed to operate. At least you mentioned a paramedic.
Yes. So I'm sorry, go ahead.
No, please, you.
So right now, the way that it's set up, so in the immediate, so at this present moment, we're targeting homebound COVID-19 vaccinations. That's been our primary mission. And then as we're beginning to transition away from that, it's, from what I've come to understand, our goal, like I said, is to catch those who have been missed. Either they're not targeted specifically, or they're just not interested at the moment that someone makes access with them, to get them into a rehabilitation program following an OD. So that's kind of like really targeted as to what we're doing as our program progresses, because we are brand new, like brand new, like I'm writing the protocols brand new. As we progress, I believe on the table is working with mental health and other aspects of those underserved communities.
Do you foresee that mobile health initiative expanding? I mean, I'm guessing that right now it's crawl before you walk, even. So hard to look over, but Montgomery County is a big county, and there's a lot of service area there. Do you see the possibility of either expanding the program itself at the county level, or working to establish like nodes, I guess you would say, in some of the municipalities?
I think that's kind of like a long-term goal to perhaps expand to that point. But like you said, we got to crawl before we walk, before we run. We got to get our foundation set up. I know right now we're targeting Norristown is one of our big ones. Pottstown is one of our big ones, just because of the population density and the socioeconomic status that's typically found in those areas. There are other areas that we have found through our COVID programs that are a little more surprisingly underserved, but not so much. I'm from Bucks County, so I'm still learning this area. I grew up in Levittown, so this area is all brand new to me. But the areas out towards like Red Hill and Bardo, all of those areas have also pretty well, I don't want to say well underserved, but you would, sorry.
Hi, substantially underserved, yes.
Yes, thank you. Sorry, I have a 2-year-old and a 1-year-old, and I'm outnumbered.
God bless you. One last question from me, and then I'll let you go beat the kids.
You're fine.
Do you foresee integrating police agencies into that mobile health intervention or initiative?
We do. We're really hoping to incorporate all of the agencies, all stakeholders in with our program, because that's the only way that this is going to work. It really is the only way. And that includes EMS agencies, police departments, fire departments, community leaders, church groups. You need all of those people in order for the program to be successful. Like I said, I'm not from the area. For me to come in and say, hey, this is what's going to fix your program, or this is what's going to help you, that's just not going to work. And we need those other agencies to help us, especially law enforcement, because they're the ones that I think we can maybe agree that they kind of deal with it up close and personal.
The point of contact is right there. Yeah.
Mhm.
So, well, that's great. It sounds very promising. I hope we'll hear more about it in the near future. And, I'm glad you were able to participate in this today.
Thank you so much for having me.
Yeah. All right, now go do something with those kids.
Nap time for everybody.
All right. I'm going to bounce this around a little bit. Is there anybody here from in this chat, in this breakout, from Chester County? Hearing none. How about Delaware County? Or Philadelphia County? All right. Then with that, I wanted to see if we could get the representation around. I'm sorry, was somebody speaking?
Oh yeah, I was just saying I go to school in Philadelphia County, but originally from Monroe County. So I've seen both sides.
Monroe County. Yeah, that's a little rural.
Yeah.
Yeah. Sade, what are you doing in school? And where?
So currently I go to University of the Sciences in Philadelphia, and I am enrolled in the Philadelphia College of Pharmacy. So right now I'm in my fourth year pharmacy, which is basically the fourth year pharmacy students getting acclimated to different roles in pharmacy and different practices. So currently I'm doing a more non-traditional pharmacy role with the community behavioral health aspect of it. So as of right now, I'm working on a lot of projects involving antipsychotic usage, drug monitoring, and how to educate providers on how to appropriately, prescribe antipsychotic and other medications like that. Definitely, this presentation has been a little bit interesting because, especially working in South Philly in a community pharmacy, I definitely firsthand get to see a lot of the effects of SUD in a lot of patients, and it definitely is something that patients struggle with. And in the particular pocket that I work in, it seems like a lot of the patients there have a really good relationship with law enforcement. So it's really nice to hear about how not only are they building relationships in other counties and how they're integrating, how to treat substance use disorder, but also like really focusing on the community aspect of it. Because I think at the end of the day, when I see my patients, their biggest fear is just them facing the stigma. And then while they're facing the stigma, they feel like they have no other choice but to resort to those activities. So it's good to know that they have a support system around them. So I hope to see something, in both Philadelphia and just Monroe County and in general.
Outstanding. Thanks for sharing that. And good luck in your studies. South Philadelphia is probably the second most heavily impacted section of the city in terms of overdose events and fatalities. Based on the data that we've seen, it's been a place where it is growing at a far more rapid pace than in the eastern part of the city, which has traditionally been the center. Things have kind of stabilized there, largely because of the service providers that are in the area, and the police assisted diversion program operates in that space too, that the Philadelphia Police Department engages in. With assistance from some of those treatment and I believe it's Northeast Treatment Centers they work with and Prevention Point. That said, South Philadelphia is the underserved in a lot of respects when it comes to substance use disorder, and so having people like you at least understand what's going on down there is encouraging. And maybe it'll lead to some change there as well. I'm going to jump over to some of the folks from Bucks County. If I can I put you on the spot, Melissa? Tell us about, some of the efforts that you've been undertaking through the council and through your community-based organization there. Melissa, if you're still with us.
So I'm not from Bucks County.
Oh, I'm sorry.
To me. So sorry. I'm actually from Philadelphia as well.
Melissa, I'm sorry. I apologize. Let me please tell us how you're involved with substance use disorder issues, and how, if any way, you're working with law enforcement.
Sure. So I'm kind of like Sade. I don't know if I'm pronouncing your name correctly, but I am a pharmacist. I've been to a couple of these meetings before. I think the last meeting that we had, we did have the DA speak. I don't remember from which county. And it was interesting to hear about the partnership with law enforcement, because I'm just 2 years out of pharmacy school and never really, I guess, understood like the partnerships that were going on, and kind of how this is a really cool intervention of getting people help, because it is so, substance use disorder is so entwined with law enforcement. But yeah, I'm actually just starting a job at Community Behavioral Health, where Sadi is doing her rotation. So I'm sure I'll see you soon. I'm starting actually on Monday.
Outstanding. Thank you very much. I apologize for mixing you up. Was it Melanie then that was
Yeah.
counsel? Yeah, I'm sorry. Forgive me. Forgive me.
Well, my manager's name is Melissa, and people are always mixing us up. So it's so no worries. Well, I mean, we've got offices in, well, I'm based in Bucks, but we have our Southern Bucks Recovery Community Center in Lower Bucks, but then we also have we have a recovery community center in Montgomery County. We have a center in Chester County now. We also have Philadelphia, and our Philadelphia recovery community center, they also are involved. We've got CRS is involved with the PAD program. Of course, we're involved with the warm handoff in in Bucks County, and also in Philadelphia County. So we're involved with that. I'm not personally, but others from our agency are. We're also involved in a lot of advocacy efforts. So through our ProAct group, which is, and we're working on the recovery walks for September, which should be interesting. Last year it was virtual. This year, it sounds like there's going to be some people there. I don't know. The number seems to be growing as things open up more, but we don't know yet exactly how that's going to, pan out. But so we're involved in, advocacy, working with the law enforcement, working with people in recovery and providing the support. Personally, I'm in prevention, so my role is tends to be more on the prevention, although again, I have been involved with our BCOPE, the Bucks County Overdose Prevention Education Collaborative, which we used to meet monthly. Now this year we met less often, but then we had an event this spring to raise awareness about, basically our topic was, what happened with overdoses and the opioid epidemic over the pandemic. So it was kind of, the epidemic during the pandemic and how COVID impacted that numbers and services and that type of thing. So that was our focus. We, of course, are supported by the Bucks County Drug and Alcohol Commission for that initiative. So that was something that we focused on this year, especially because, during the pandemic, it's not like people weren't using, and it's not that the overdoses weren't happening, just we didn't always hear about things, and unfortunately people often didn't get the help that they needed because of all the restrictions and lockdowns, that kind of thing. So and then of course I'm involved with the take back, which our great DA had spoken about earlier, Matt Weintraub. And so we with that we we unfortunately had to skip the one last April because everything just locked down. But then in the fall and the spring, we decided to do we called it like a drive up, drop off, or drop in contactless, COVID friendly event. So instead of doing, normally we have volunteers dispatched at our locations, which we usually have around 50 locations in the county that collect medications on take back day. So we've got a lot. Because we try to make it as accessible to the community as possible. People don't want to go that far. But we decided we would do it where people just drive up. They don't have to, make any contact, and they just drop off their meds. And as it was mentioned before, we also had 3 sites, including Bensalem. Thank you, Fred, who collected sharps and also distributed Narcan. So that was the first time, and there was 3 sites that did that. It was very successful. I believe we had like over 200 Narcan doses that were distributed. Mallory or Fred can correct me if I'm wrong. But we had, and we collected 450 pounds of sharps. So that was meeting a need. We've had a lot of requests for that over the years, and Narcan as well. It was really good to be able to get that out in the community and give people access to that. So we're hoping to maybe expand that. It was sort of a pilot this year, but we were really excited to be able to offer that as part of our Take Back initiative. And so that's, I'm trying to think if there's anything, as I said, our agency is involved in a lot of different areas, but as far as recovery supports and overdose prevention, but we're also involved in the prevention. And so we look across the continuum, and we're also always trying to work on reducing stigma, which is huge and a huge barrier to treatment. So that's something that, we continue to work on. So I think that's it. But, we really appreciate, I truly, what we are able to accomplish is a result of collaboration among organizations and, law enforcement, the DA's office, the Drug and Alcohol Commission, and, businesses, like all different partnerships. Really, that we found that that's proved to be the most successful in getting things done and seeing outcomes.
Yeah, law enforcement's been involved in substance use prevention efforts for decades now. I'm wondering, from your 17 years, which is how much time I have with HIDA, have you seen changes in how law enforcement prevention efforts or collaborations in prevention efforts have evolved?
Yeah, definitely. I think the Take Back was a really great way to be proactive. I think it gave law enforcement an opportunity to do something proactive, because, and it's tough when you're always on the other end of things, doing the reactive end of things, and that's just the nature of the job, unfortunately. But I think it really helped change some perceptions around law enforcement by doing something more proactive. And it's such a huge service to the community. We always get people thanking us and and thanking law enforcement for their service. I know in some communities there were some people that were hesitant to approach law enforcement initially, just because of just the nature of their perceptions. And I think it helped to change that and change some attitudes. So I think that was really positive, and just giving community more access. And then, of course, what Bensalem's been doing was really innovative. Sorry, there goes my clock shop situation.
It's good. It's going to keep me on time.
But so, it's slightly fast, but I think that's really made a big difference too. And it started in Bensalem, and now it's really significantly expanded. I remember when Fred actually came to our Breakout meeting a number of years ago and presented on this, when it was, Bensalem police assisting in recovery, and he's talked about expanding into other police departments in Bucks. And I think, again, it's just sort of changed the way people perceive law enforcement in Bucks, and I think it's made a big difference that way. And it's also, I think, enhanced the cooperation that the various organizations have with each other and law enforcement. So we started the Take Back in 2010. And I know I think there's definitely been, and then since then, some of these other programs have evolved, and I do believe that that's really made a big difference, and also just helped ease people's concerns or apprehensions about approaching law enforcement for help, and seeing them in a different way, that they're not just reactive, that they can be proactive, and that that they can really get help. Another thing that we had with BCOPE a number of years ago, there was some concern about, so we had some parents express concern about if they found heroin, for instance, or some kind of drug in their home, and they wanted to dispose of it, but they were afraid that they were going to get in trouble if they did. And at one point in time, that was actually a true concern. But because of the DA's approach on that now, it's a different perspective. Like, look, we're just trying to get you help. Call the local police department, but no matter what, like at the DA's level, they're not going to prosecute you if you're turn in. And so that became also another issue that was discussed, and sort of an unwritten policy, but that's really another really helpful. I think it's just helpful as far as reducing stigma and encouraging people to get help and knowing that they can go to law enforcement for something positive. So yeah, I mean, I've definitely seen, especially in the past decade, huge changes, which is great. I think it's really positive, and I think it really, you know, the more of us that can work together, the better.
It's great to hear your perspective from, you know, being on the prevention side about the metamorphosis, if you will, you know, of law enforcement in that regard. A couple of things you said I just want to kind of highlight on or hit on. You mentioned the multi-purpose drive-through, contactless, take back sharps disposal and naloxone distribution effort. That's a fantastic adaptation of what was, you know, once a very singular, a one-trick pony, if you want to call it that, and making it a much broader affair. And I'm sure there was a lot of law enforcement personnel in all the locations engaging in that. So that's really cool. Number two, you sort of alluded to what I call the convening influence, power, whatever you want to say, of law enforcement to bring organizations with similar goals, but not necessarily completely aligned together. And I think that's an important part as well, you know, of the law enforcement role generally, even if it is just to get, you know, organizations together across disciplines and across communities, particularly in a county as large and diverse as Bucks County is. That's sometimes really difficult. And then finally, you know, just what you were saying, you know, towards the end, you know, they're about you know, the ability now to reach out to a Director Herron or to a chief in another community, and the district attorney's involvement. I think those are all enormously important steps in creating these kind of opportunities. So, you know, good on you for developing that. Good on for the law enforcement community in Bucks County for promoting that so much. Mallory, I've let you be quiet for a while there, you know, for thus far. So it's kind of segueing off of what we were just talking about. Would you care to jump in with anything from Bucks County's experience?
I don't know how much I can really add. I mean, I think Melanie, you know, Melanie's perspectives being in prevention with the commission, I think they're, you know, probably pretty similar. I mean, you heard from Director Herron and DA Weintraub earlier. I think that says it all in terms of this is why we're able to do what we can do. And you need that leadership and that support. And I mean, I think that's just, you know, it's not everything, but it's definitely a big piece, and it helps in bringing, I think, with everyone wanting to bring the systems together and bring everyone together to, you know, to work on solutions. I mean, that's what you need to do. So,
okay. Thank you.
Yeah.
Thank you for jumping in there. I'm going to throw out just a kind of a toss-up question. Given, you know, our racial and cultural diversity, economic diversity in the region, we have many people who are at least, you know, if not off put by police, at least wary, I guess, of policing. Does anybody have any thoughts on how else we might break down that barrier, considering, you know, the what would you call it, the national discussion on policing generally has, you know, really brought this to the top of the punch list. Anybody? Go ahead, Jamal.
Yes, it's Jamal again. Well, being one who's experienced that, right, and one who lives in areas where one of the things I think that can really break down the hesitance in that aspect is approach. Approach is very, very important in anything that's done. no matter what, right? If you approach a situation in a demeanor of care, right, the reactionary, right, because most people are going to react, especially when it comes to the substance use disorder, right, is going to react defensively upon first sight of a police officer. That's just like it's just like a natural reaction to a reaction, right? And from the officer side, because the officers I work with understood that and they implemented more. Body language is 75 to 80% of communication. So your approach is one of the ways that you can minimize the hesitance, right? There's a different approach to say me walking up to someone in substance abuse as opposed to a law enforcement person walking up into, and a lot of that comes with their initial training, right? They are always on point, on guard. It became a habit. So their approach, changing that approach comes in time. But being aware that how I walk up to someone or how I approach someone can determine partially the reaction that I receive from these individuals. And when we go into these particular neighborhoods, societal aspects of what goes on in these neighborhoods, we can't walk into that with that in our mind, even though it exists. Right? We can't walk into it like I know I'm in the worst neighborhood or I'm in a very bad, hostile neighborhood, right? Because if we're thinking about that, naturally our demeanor is going to show the tenseness of that situation. And one of the things I do, because I actually go into some real dangerous places, like I share with folks, me walking up to an individual alongside law enforcement agent endangers my life. How does it endanger my life? Because in the world of substance use orders or any type of drug consuming, anyone affiliating with the officers is seen, as we all know. We all know how the perception does, right? So even though when I'm not at the officers, I can be walking through town and I can be perceived in that manner, which can, put my life in danger, right? So whenever I'm working besides one of the officers, I really encourage them, like, listen, our approach has to be one from a genuine care, right? If you really want to break down that barrier of distrust, then it has to be presented with care. It has to be presented with care. It won't be received no other way. And it takes time. It ain't gonna happen the first time, but when you repetitiously approach someone with the genuine aspect of care, they tend, even those using substance or suffering some substance use disorder, 90% of us are void of care. We believe that no one cares and no one loves us, right? So every approach that doesn't represent caring approach is gonna be reacted that way. So in the diversity approach, right, we have to spread it out around the board. We got to approach every individual, no matter ethnicity, background, gender, sexual gender, with care. Simple care.
Appreciate that. I see, Fred, you turned your camera on and unmuted. I'm sure you've got thoughts yourself, and you've got certainly lived experience of your own in policing. So please jump in.
Oh, I think, police are really working outside their norm, their comfort area.
Their comfort zone.
We have become social workers, addiction counselors, mental health specialists. We're doing everything that is requested and is needed. I think there's a lot of breakdown in the government, and a lot of the resources aren't getting to the streets of America. And I've said that before. Jerry, you and I had this conversation just the other day on the phone.
Mm-hmm.
But I also think, we have deployed social workers. We're having use of force training, diversity training. I mean, everything under the sun we're doing. But the one thing that I get a little upset with the general public is that no one is pushing the model that the street is not the place for the trial and the jury verdict. It is the place for, whatever is going to happen as far as arrest. And then if you're innocent, it's not the time to fight with police, whether you're suffering from drugs or mental health. Obviously, mental health has its own issues, but, people continue to forget that narrative. And I tell, and I've told a story about when I was 16 years old in New York City, where I grew up, and I just happened to be in the wrong place at the wrong time. And I turned around, and a New York City police officer had his gun to my head. And to this day, if I would have made some other affirmative movements or something, you know, I didn't have there was no cell phones back in the mid 80s. I'm old. So, you know, if I would have reached for my cell phone to go to videotape him or her, what they were doing, I probably wouldn't be talking to you all right now. I probably would have been shot because I matched the description of an armed subject that just committed a robbery. And here I am, a white male. So, you know, I just wound up with a gun to my head. And it just was, but I cooperated. And in 3 minutes, I was on my way. Once the officer realized that I was not the person they were looking for. But, you know, I think we need to preach, you know, the street is not the place for the trial by the suspect. And it gets me a little annoyed that we never hear that anymore from anybody. We keep doing more and more stuff, which I'm happy to do. And I think law enforcement is happy to do it because we see, you know, the need for it. But I think we're not getting, you know, we're not getting back. And to hear the PhD this morning, I forget her name, and I was texting her privately, emailing, on the chat, I was quite annoyed that she's an academic. But as Jerry, you well know, 90% of higher of our delivery cases start with possession cases. You don't get introduced to Pablo Escobar by accident. It just doesn't happen. You have to work your way up to Pablo Escobar. So when I hear academia talk about what they think, because they're looking at some crazy statistics, which I can refute, it kind of gets me annoyed, because if you want to just stop arresting people for dealing drugs, then go ahead and do it. But you better build a lot more morgues out there. Because if we don't attack this drug problem with three approaches, obviously we're doing one now, and I'm all for prevention, education, rehabilitation. Those that know me on this, Mal and Melanie, I am 100%, you know, in pushing that, but you cannot leave out that enforcement component. It just cannot happen. If you're not arresting the dealers, and unfortunately, as Jerry, you know, we can't get to the dealers unless we get the users in some degree. I'm not talking about people that need help. I'm talking about other types of stuff, but we'll get them help, but they still have to pay the piper to some degree. So for people to say we need to cut out all possession cases for all narcotics is just ludicrous. And I would have liked a little debate with the first session, but you know, they didn't allow that. And you can't really get into a debate in a chat. So you can't get, and she just doesn't understand that it's just not, and she just kept email me back the statistic page to go look at that. And, you know, she has no idea what it really takes to make a drug case. And again, we don't get introduced to Pablo Escobar and come across him by accident. So with that said, I leave you with my Jerry Springer thoughts. And
well, I appreciate the perspective. You touched on something that I didn't get to touch on the panel this morning. We were thus far, you know, in the breakout. And I just want to put it out there. You did touch on this part of it, you know, with all of the, you know, responsibilities that are being dropped on police agencies from, you know, A to Z, basically. They're the only ones that are out there 24/7, 365 out, you know, in communities like that. I mean, we can certainly laud our, you know, colleagues in firefighting and emergency medical services, but they're always reactive. They're always responding to. Whereas police are out there proactively, you know, patrolling neighborhoods and you know, being watchful, I guess, in those communities. That said, we've asked them to do things that really they don't have the skill set for. And I mentioned toward the end of the morning session about some of the training programs that are coming around. Do you foresee, Fred, or anyone else for that matter, do you foresee a kind of a retooling of either police basic training or continuing training? And I think a lot of folks outside of law enforcement don't understand that, like doctors, like pharmacists, like attorneys and so forth, we have state mandated, you know, annual training requirements that we have to go through if you're in municipal policing. what do you see changing with respect to the substance use disorder issues and such in regards to that training?
You know, I'll answer that, but I used this analogy the other day, and those of you, see me a lot more, I like to throw analogies out, but a doctor doesn't put his scalpel into you until you have to go to the hospital for the pre-workup and MRIs and CAT scans and this test, because they want to know what they're getting into before they go to fix the problem. Police don't have that luxury. We don't get to review your whole mental health history, your family history, your work history, your school history, what problems you had, what you picked on when you were 5 years old. We have 3 minutes to go, and I use the term loosely, hands-on to fix your problem. So, everybody else, lawyers, accountants, everybody else gets to examine what they're getting into. We don't have that luxury. So with that said, Jer, I think you're going to see changes in law enforcement. I truly believe the co-responder model is going to be the model to use, whether you're using, Albuquerque, New Mexico, which is what we modeled ours after a little bit, which I did some research, and when we brought ours to Bensalem. But I think the co-responder model is going to be a model for law enforcement, because we don't have the expertise and we don't have the time. And the problem is there aren't the resources available. And the government, instead of, some of the stuff that they waste their time on in Washington and Harrisburg, knock it off and let's get boots on the ground, the problems that are really facing America, and not some of the silly stuff that are out there. I grew up in New York City. So, when I see them spend here in Pennsylvania, $20 million for a new park, I'm like, my God, you know how many co-responders we can get for $20 million? Parks are important, but let's get our priorities. When the ship is sinking, don't worry about a new bell. Let's fix things and move on. But I think the co-responder model and the BPAIR model and the response model, the B crew, the LETI model, all these things are going to be what law enforcement is going to be seeing in the next couple of years. And they're good things. But as you well know, Jerry, I would never give up, a police officer's position, because at the end of the day, you need police out there to respond to 911 calls. I mean, these cities, I just don't understand. Philadelphia is online for what, 600 homicides this year? How do people accept that? I just don't understand. And most of it is drug related. So we have to continue to fight. We have to put the social service resources behind and work with law enforcement. It is going to be a partnership. And the co-responder, not just with mental health, but everything else, I think is going to be the new model. What Bill Clinton did in the 90s with community policing, and Bill Clinton, he was very smart about it. He vowed 100,000 more police on the street with a twist. He wanted them to do community policing. And I think if Joe Biden wants to make his mark, his legacy, I think this would be a good legacy for Joe Biden. He's the president of the United States, and he can do it. And I think you can do it and get the best of both worlds and get that co-responder in mental health and increase your social service, increase your drug prevention world, the Melanies and the Mallories and those folks. You need to increase them, and you need to increase, social workers, not only on our streets, but also in our schools. Bensalem Township has 3 social workers for 7,200 kids. That's ridiculous. Now, you know how many gym teachers they have? I'm not picking on a gym teacher, but let's face it. Let's get some more social workers out there. How many steal the bacon classes do you need? I don't even know if they play that anymore, but you know what I mean? So we need to really set our priorities. So I know I can chat, but I've got to run. I got to be somewhere at 1:30, but my contact's in the chat if anybody needs to get a hold of me, and we can talk about co-responders and BPAIRs or whatever. Good places.
Thanks
to
for your
eat dinner.
perspectives. Appreciate
Thanks,
you
guys.
for being part of this, Fred.
Thanks, guys.
See you now. Just following off of what Fred was talking about, I mean, another part of this is what some people call compassion fatigue, particularly among first responders. And that's been a kind of a if you want to call it a PTSD, post-traumatic stress disorder symptom for officers that are in communities where repeat calls for overdoses and repeat calls for intervening in situations involving persons with substance disorders, are just wearing them down. I think to Fred's point, as we evolve further and can put more of these co-responder programs, that will take some of that pressure off. Obviously, you have to have the right people and you have to have the resources to do it. We are at a point now where a great deal of money is going to be infused from the federal government, and how we use it will be very important in that respect. You heard Secretary Smith speak this morning about advocacy. So, I encourage you to follow her, directive there. I'm not going to tell you what to advocate for, but what are priorities in your minds. Just make sure you let the people that appropriate the funds know where your minds are at. Any final thoughts from anyone? Because we are approaching the bottom of the hour and we got to shut down at 1:30. Anything from anyone else do you have a question? Do you have a comment that you want to make before we close?
Yes, I will. First, I'd like to thank all of y'all. It's nice meeting y'all. I really
Nice meeting you,
I
John.
really wanted to thank the director Hannah in another perspective, and apologize to him for society, him and other police officers for society putting that responsibility from changing the police officers from public servants and protectors to becoming public everything. Right? Because that is exactly what happened. Systematically, society has failed the officers in that aspect and started relying more on the officers to solve all uncomfortable situations, right? And they wasn't properly trained nor created for that. So I definitely want to apologize to him for that and understanding that part. Yes, we one of the things that can help change the dynamics is to simplify, once again, simplify the purpose of having a police department. When I grew up, because I'm from New York too, like him, and I'm pretty old too, it was protect and serve. It used to say that on the cars. It used to say protect and serve. You don't see that on no cars now, right? Even in New York, now it's something else. But protect and serve is not the model no more. Now it's just come and save us from any uncomfortable aspect, whether you emotionally, mentally, psychiatrically prepared. Just come on in. 911 has became to me a scapegoat for responsibilities, and now we want to chew the police officers out for not being able to do it in a feasible manner, right, so to speak. So one of the things that need to change, yes, we can continue to train them and add trainings to the officers, all that well, but I believe we need to take a society approach and start more so informing and training society to have to eliminate the usage of the police officers and just misusing the police officers for every single situation, right? If it isn't a crime related or a direct crime related situation, calling the police is really just utilizing the services instead of addressing the situation